The blocked nose doesn't only affect the nose, only blocked nose and facial pain. It really affects the general health of the patient. Let us start step by step. First, at night, the patient doesn't sleep well because he gets blocked nose at night. He wakes up frequently in order to use some nose drops, and again when his nose is blocked, he starts to snore. So when he doesn't sleep well, he wakes up in the morning tired. Why? Because his heart was trying to compensate for the loss of air and loss of oxygen. So his heart tried to beat more. So he wakes up in the morning feeling tired and exhausted. And because of the lack of oxygen and air in his brain, during the daytime, he will feel sleepy all the time, lack of concentration. If he's a student, he may just sleep during the classroom. If he's an employee, he might just have again nap of sleep during meeting or during his work. And again, always the patient feels tired quickly, loss of concentration, exhausted, and for example, mainly for students, it may affect their really education and academic progress because really they cannot study for a long time. If the student study for half an hour, after half an hour he feels fed up, he doesn't want to study anymore because he's not getting enough air and oxygen to his brain. So therefore it will affect really their academic performance. Again, for any male or female, this lack of oxygen in the brain will cause them to feel always very nervous, and they can get angry and excited more quicker than the others. So the blocked nose really affects the general health more than it affects the nose itself. So the snoring at night and the lack of concentration and sleepy during the daytime. Also in long term, it will affect the heart. The patient may get hypertension, may get later on heart failure, and even pulmonary edema. Edema in the lungs. So therefore, it's very important and mandatory to treat your blocked nose. The most common cause of blocked nose is deviated nasal septum and enlarged inferior turbinate. Usually treated with a procedure less than 30 minutes under low cancer with sedation using an endoscopic approach, and usually 1 day in the hospital. This is Bashar Bizrah, certified by the Royal College of Surgeons of England in Rhinoplasty, and the really most benefit of doing the surgery with us that we do the cosmetic procedure at the same time, plus the functional procedure if the patient needs to have a cosmetic procedure. Thank you very much for watching me.